If you've been thinking about getting breast augmentation, you're going to want to watch this video all the way to the end. This video will answer many of your questions as well as stimulate new ones so that when you have your consultation with your doctor, you will know what to ask. Here we go. Let's talk about important things before you go into your consultation. The number one tip that I will give all of you is that you have to be doing it for yourself. Do not be doing it for anyone else. Everything from the size of the implant to your final look will depend on factors that are unique to you. So before you go in for your breast augmentation consultation, just remember and keep in mind that your body and your physique is totally different than everybody else. Let's talk about if you're planning on having children. If you're planning on having children within the next 1 to 2 years, then I would not recommend that you have a breast augmentation at that time. The reason for this recommendation is because we all know that having children will change the quality and the dynamic of the skin and the tissue of your breast. Next, let's talk about choosing your surgeon. The first thing that I always recommend is that you choose a board-certified plastic surgeon by the American Board of Plastic Surgery. Why is that important? Well, you don't want an OBGYN doing your breast augmentation. Yeah, that happens. The next tip that I'll give you is something that I see quite often, and that is patients typically will choose a surgeon who is the cheapest. So let's face it, we're talking about surgery. You're electing to have someone make incisions and perform a procedure, cutting corners. This is not the time to do that. Now, the best tip I can give you is that if you're thinking about having a breast augmentation, you should fly to Scottsdale, Arizona and let me be your surgeon. Next, let's talk about choosing your implant, silicone versus saline. One of the things that makes silicone so popular is that it's a very soft, natural feeling implant, whereas saline feels like a water balloon. Now, one of the pros to saline implants is if this ruptures, the salt water leaks out, your body reabsorbs it, and your breast deflates, and you go, that's not right. Now, silicone implants, on the other hand, when they rupture, they may have a micro perforation in the shell, and they don't just ooze the silicone out because they're highly cohesive. You can see in this video when you cut this implant in half and you apply pressure to the shell, the gel will egress out of the implant, but as soon as we take pressure off of the shell, it goes right back into the implant because it's highly cohesive and it all sticks together. For that reason, the FDA has the recommendation that if you have a silicone implant, you should get an MRI 5 years after augmentation, then every 2 years thereafter to evaluate for rupture. Nobody does that. So who would benefit from one versus the other? Well, that has to do with skin quality and breast tissue quality. Now, a younger female who might not have ever had children could have really good quality skin that's thick and have very glandular thick breast tissue, and they could get a great result with silicone or saline. Now compare that to the mom who's had 3 or 4 children, who's had milk come in and out several times. They have thin skin and not really good quality breast tissue. A saline implant might feel like a water balloon and be really firm, whereas a silicone implant would be much softer and more natural feeling for that patient. That being said, you can get a beautiful result with saline or silicone no matter what your tissue type is. Let's get into how do we choose your size. When it comes to choosing implant size, the first thing I tell my patients at the consultation is to defocus on a particular cup size or implant size. The reason for this is no surgeon can promise you a C cup or a B cup or a D cup. That is why breast augmentation should never be about the cup size. It should be more about a look that you are trying to achieve. I am really big on what I call wish photos, aka vision board photos. They help me for 2 reasons. Number 1, by looking at your vision board photos, I'm able to understand exactly what shape and size you're going for. Number 2, vision board photos help me manage your expectations. The goal here is to nail down exactly the specific look that you are trying to achieve. Next up, let's talk about incision placement. 99% of the time, I use the breast crease incision. There's a few reasons why I prefer that. Number 1, it's only 3 to 5 centimeters and we can camouflage it in the crease. Sometimes it ends up a little bit up on the lower part of the breast, but those can all be covered by bathing suits or bras. The other reason I prefer that incision is I feel like the visibility in creating the pocket is much easier than any other approach. Let's talk a little bit about the consultation. At your initial consultation, I will take your breast measurements to help me choose the right implant in conjunction with your wish photos. I will also point out on physical examination the subtle differences between your breasts because everyone is uneven. Why is it important that I'm pointing these things out? Because when you augment the breast, you augment the asymmetries as well. So just remember, you're asymmetric to start with, and you're going to be somewhat asymmetric after your surgery. Next, let's talk very briefly about preoperative clearance. In my practice, regardless of whether you're 22 years old or 52 years old, I send everyone to see their primary care physician to get preoperative clearance. The reason that I do that is because a lot of times young women are coming to see me and they haven't even seen a women's health specialist to this point. Let's talk about the day of surgery. On the day of surgery, again, I will come into the preoperative area. I will review your wish photos as well as get your preoperative markings. Once that's done, you'll meet your anesthesiologist, you'll get your IV, you'll get medications, your happy medications, I call it, before you go back to surgery, and then it's time. Next up, let's talk about recovery. There will be no heavy lifting more than 20 pounds for 6 weeks. Incisions scientifically do not have their full strength back for 6 weeks, and if you apply too much pressure to that scar, poof, it pops open. You could be staring at an implant. In addition, I will make you not do any cardio for 1 month. When we create that pocket, we use electrocautery to cauterize little blood vessels. If your heart rate goes up too much within that first month, you can blow a clot right off the end of that vessel, and then you bleed what we call a huge hematoma into the breast, and you got to go back to surgery. Now you've had your surgery, you're in recovery. Let's talk about post-op. I usually see my patients within a few days after surgery. Then I will see them at 1 week, 6 weeks, 3 months, 6 months, and 1 year. I think one thing that is really important for you to know is that this will not be your last operation. Your implants are not going to last you forever.